Hello, everyone. My name is Melissa Wright, and I am the Director of Patient Engagement and Outreach for LymeDisease.org and Project Manager of My Lyme Data. I'm so happy to be here with you today for the Tick-borne disease diagnostics and innovation incubator and have the opportunity to speak with you about the impact of diagnostic delays in the Lyme community. Founded over 30 years ago, LymeDisease.org is one of the oldest Lyme disease organizations in the nation. It is the largest and most trusted communications network for Lyme patients. And our mission is to harness the power of tens of thousands of patients to improve patient care and accelerate the pace of research. We do this through providing tools like our symptom checker, physician directory, and My Lyme Data patient registry and research platform, which has over 15,000 patients enrolled. Today, I'll briefly be discussing with you diagnostic issues using data from My Lyme Data, current testing, and what we are doing to push the needle forward. So using a diagram first developed by the Institute of Medicine, now the National Academy of Medicine, in its report, Improving Diagnosis in Healthcare, which identified different points along the path to diagnosis where things can go wrong and diagnosis can be delayed or missed. It has been modified to reflect the diagnostic issues we encounter in Lyme disease. So for example, Lyme is not identified as a possibility in name your state. Many patients do not present with a classic EM rash, and the diagnostic testing, as we know, is flawed, which leads to a large majority of patients being misdiagnosed. So I'm going to talk to you a little bit about diagnosis. In My Lyme Data, we found that 70% of those with late or chronic Lyme disease experience years of diagnostic delays, even though 45% had presented with early symptoms. But it had taken the majority 3 or more years to be diagnosed, but only after they had seen 5 or more doctors, with 72% reporting being misdiagnosed, which means they were likely unnecessarily treated for another disease. So why the delay? Because we know in Lyme disease, early diagnosis can be a ticket to recovery. 70 to 80% of people do become well. But unfortunately, a diagnosis of early Lyme disease is not so straightforward. A lot of the symptoms are not specific to only Lyme, and they do occur in other illnesses. So there's a big emphasis on whether the patient has distinguishing factors. So remember the no Lyme in your state. Were they exposed to an area where there are ticks that carry the disease? Or did the patient have the distinctive round rash that could have been caused by a tick bite? My Lyme Data shows that only 34% of patients report having a rash. And were any of the blood tests positive? Well, insert the flawed testing, with 37% in My Lyme Data receiving a false negative. So I'm going to highlight the testing here. We know that during the first 4 to 6 weeks of Lyme infection, standard Lyme disease tests are unreliable because most people have not yet developed the antibody response that the test measures. And even later in Lyme, the 2-tiered testing is highly insensitive. So this chart that I'm showing illustrates the studies examining the testing. As you can see, the mean sensitivity for Lyme testing is 46%, which means 108 of every 200 cases is missed in Lyme. But compare that to the highly sensitive testing for HIV and AIDS, which has a mean sensitivity of 99.5%, where only 1 in every 200 cases is missed. Simply put, the likelihood of getting diagnosed with Lyme disease from a positive lab test is the equivalent of a coin toss, which means that many patients go undiagnosed. So what can we do? Now, everyone knows the saying, there is power in numbers, and there is. But despite Lyme disease having 475,000 cases annually, little has been done to advance Lyme testing or research. According to research by Goswami, the number of clinical studies for Lyme disease trails behind leprosy, which has an incidence of less than 200 cases per year. So Lyme disease should be thought of as a research disadvantaged disease that faces the same challenges that rare diseases face. Patients are the most underutilized resource in medical research, and we are striving to bridge that gap. The research cycle illustrated here is derived from Groff's work with rare diseases. His model suggests forming a patient registry that links with a biorepository. We are currently collaborating with Lyme Disease Biobank here. The registry then helps to develop a research hypothesis. Here we have published 3 peer-reviewed publications to better characterize the disease, assess patient-reported outcomes, and analyze treatment effects among patient subgroups. The registry can then be used to help recruit patients, and we have worked on recruiting for 2 clinical studies. A team research approach will allow rapid knowledge generation, which will accelerate the pace of research, which will improve diagnostics, treatment, and care. Thank you all so much for your time today. I appreciate the opportunity to speak with you, and I want to close by encouraging anyone who is not already participating in My Lyme Data to enroll.